today we're going to perform a sterile dressing change. I'm going to start by reviewing my physician's order, making sure that I need to change the dressing and when I need to do it. I'm going to gather up all my supplies, set it up on my sterile field, knock on the door, identify the patient by their name, birth date, and then I'm going to provide for privacy and wash my hands. I'm going to ask the patient if they're in any pain at this time, and if so, I'll give them some pain medicine, and then I'll assess them again in 30 minutes. So we'll put on clean gloves, and then we'll start to remove the dressing. Pulling up any of the old. And then I'm going to look at it and notice any drainage, if there's any difference in color, any smell to it. And then I'm going to throw it away. And then I'm going to start by assessing the wound itself. If the wound needed to be debrided at any point, I would have already moved the patient, debrided it, changed my gloves, moved the patient back into position. And then we're going to start by measuring the length of it by not touching it, and then measuring against here. We're going to measure the width, and then we're going to measure the depth. And then we're going to check for any undermining or tunneling. I'm going to dispose of that. Remove these gloves, perform hand hygiene, and then we're going to start with our sterile field. I'm going to start by opening everything away from us. And at any point, if I contaminated my gloves, I would take them off and start all over again. Then we're going to start by cleaning the wound. So we're going to clean from top to bottom, inside to out. And then I'm going to pat dry. Then I'm going to start packing the wound. And at that point, if I contaminated my gloves, I would take them off and start over. And I would also remove that gauze since it would be contaminated and put in a fresh, clean one. And then I would have dry gauze and place that over the wound. And then I would remove my sterile gloves. begin to tape the wound. Start with the tape again. And then I would date, initial, and the time. And then I would cover back up the patient, wash my hands, report, and record.